Welcome on Speak Your Mind. I'm your host, Shamila Chalal for Speak Your Mind. And you must have been watching our FTC TV and listening to Gold FM, hearing about who's going to be our guest tonight. And I know that you already know about it. So I have with me Dr. Anne Viu. And Doctor, you are the consulting physician with special interest in oncology.
Yes.
What does that mean?
Thank you. Thank you also for this time. So basically, I'm a specialist in internal medicine, which looks at general medicine in adults. And my special interest in oncology is in oncology. Oncology is the study of cancer. I've had a total of 2 years training in a short stint in Hyderabad in India, and more recently in Christchurch, New Zealand. It's different from an oncologist per se. An oncologist has to go through a 4 to 6 year training, hence the title that I have today.
So we've gathered together to talk about types of cancers in Fiji. And we'll be talking to other guests today. We encourage you to call and ask any questions related to cancer in men or women. We'll also be talking to Wow's Kid Cancer about children. Doctor, let's talk about most common cancers in women in Fiji.
Yes, unfortunately, cancer is, on the rise over the past years. If you look through the Ministry of Health database, you'll see that in the year 2000, we had approximately 500 cases in total, males and females. Come 2016, we've almost doubled. We're reaching the 782 cancers last year.
It's because of the awareness which is being created. So more women and men are coming forward to say that they had cancer.
And also in terms of diagnostic facilities, now we're able to send specimens or diagnose cancers better here in Fiji, clinically and pathologically, and also send specimens abroad for confirmation. So yes.
What is the cause of cancer in women? Like as you mentioned, then from 2000 to 2016 there has been a rise. Of course, because we are creating awareness to these kind of programs. Yes. But can it be stopped, or is it because someone had it in the family and has been carried forward?
So cancer is, the causes are multifactorial. Family history does play a part of it, but you are at a higher risk of getting cancer if someone in your family has cancer. It doesn't mean that everyone in the family, though, will have cancer. It's just, it increases your risk of developing a cancer. Going down to the pathophysiology of it is genetic abnormalities. Certain cancers like lung cancer, you have direct influence of smoking, and that's both active and passive smoking. In terms of our gynecological cancers like cervical cancers, we look at the risk factors of, childbearing. And it's not that having children will make you have cancer. It's actually nulliparous, or women who don't have children, women who have a lot of children, the age in which you have your pregnancies, and the number of, pregnancies that you have. So there's actually a lot of factors that we need to consider.
So what is the most common cancer in women in Fiji?
In cancers in women, cervical cancer is number one. Yes.
How many women have so far till date?
Looking at it in 2016, we had 1,159 women who had cancers, and of this, the top was 30% was breast, closely followed by the gynae cervical cancers. So that we're looking at approximately 200 to 300 cases in a year of these gynecological cases.
But most awareness is created around breast cancer, right?
Yes.
The cervical cancer, do you think we have done much awareness on that too?
Yes, I believe we have, but we can always, we've never had enough awareness. You can never have enough awareness. We can keep pushing. Early diagnosis in breast is different from the cervical cancers. Breast is usually just lumps that you feel. Cervical cancer, like many other cancers, unfortunately, you only know it when it's in the later stages. So we have pap smears that are done routinely on.
So pap smear is very important. A lot of women may ignore, and I know because of our culture and sometimes it's the way we think that pap smear is not as important. But women should go for pap smear tests
Yes.
Every 2 years? How often is that done?
It should be every 2 years, each time a lady goes for antenatal clinic or starts antenatal clinic, and also in the risk age group, so 15 or the childbearing age group, where we encourage women to have these pap smears.
Should a woman continue to have pap smear after her menopause or premenopause?
Postmenopausal, the risks of other cancers are higher than cervical cancer, so we're looking at endometrium and ovarian by that time.
Okay.
We encourage women, though.
Would you
to
stress
continue.
the importance of having a pap smear done?
Oh,
Why
yes.
is it so important?
Because to develop cancer, like we said, the symptoms usually come in the later stages, so incurable stages. However, pap smear is the earliest and least invasive way of detecting these abnormal cells.
You see a lot of women coming forward to have their pap smear done in Fiji?
Well, more so now than in the past, and thanks to the awareness that's been through the media,
Yes.
through the Ministry of Health, and also through patients themselves. I think they've been the strongest advocates.
That's good. So what are some cancer symptoms women should not ignore?
Okay, so cancer is unfortunately one of those that, you have specific symptoms depending on the specific site. In women, though, for breast, we routinely advocate examining your breast for any lumps or bumps. You may have these depending on your menstrual cycle. However, persistent lump that feels hard, sinister, swollen glands in the armpits, these are things to look out for. In terms of a gynae cancer, any abnormal discharge, bleeding or spotting, these are things that would, push you towards just having another check and, a pap smear to confirm.
While I was preparing this program, Doctor, and we were running a lot of promos and trailers to create awareness of our topic for today, I met a lady over the weekend, and she said that she had a kind of a lump, but which was very sore. It was like a boil inside her breast. Could that be a signal or a sign?
Yes, it's common to have breast abscesses or boils, and usually it's treated as an abscess antibiotics. However, if it doesn't resolve, if it's persistent despite treatment and gets worse with skin changes, that's the warning signs. That's the red flag.
I was also reading a report which was released on July 14, 2017, this year, which said that, which was by the Cancer Society. The statement showed that Ethiopian women are more than twice as likely to have cancers as other ethnicity. Is that correct?
You would have to look at the genetic makeup of things, to confirm that. I think if generally, perhaps it's the number of cases that we see.
Right.
That's why we make that statement.
Okay.
I would feel that, we'd have to analyze things more in depth to be able to confirm and see if it's a significant finding.
So what have been some kinds of cancer support groups in Fiji to create awareness? We're going to talk about this more, and soon after this break, we'll be meeting with a cancer survivor, and she's going to tell her story and how she survived, and a very strong message for women. Welcome back on Speak Your Mind. I'm your host, Shami, and I have with me Inoke Bainimarama, who's the board member of the Society, Fiji Cancer Society. Inoke, welcome on the Talkback Show.
Thank you for having us.
And I have a very special lady here with me, Irene. How are you, Irene?
I'm good, thank you.
I see you wearing a purple today.
A survivor's t-shirt.
So that talks a lot about the survivor, right?
Yes.
And Irene, you are a breast cancer survivor.
Yes.
So how, let's talk to Irene first and hear her story, Inoke, and then we'll be talking about what the Fiji Cancer Society has been doing. I know there has been a lot of awareness on breast cancer as well. So Irene, would you mind telling when were you diagnosed and at what age?
I detected the lumps in my breast in 2015. That was somewhere around about in September. So it'll be, 2 years now?
2 years now,
Okay.
right?
I didn't get to have a biopsy done until somewhere in October. So, and then after that, I waited for my results. I didn't get my results until I was, it would have been Feb of 2016.
But you used to go on a regular checkup.
No, because I had to wait until I got the results to know if it was cancerous or not.
Okay. So how did you feel when you first received the news? It must be very hard, I guess.
No, not really.
Yeah.
Because I've had the experience of that through my mother. She was a cancer patient as well. The unfortunate thing was that that would have been 31 years ago.
Mm-hmm. So how many siblings in the family? Irene?
4. I'm the eldest, and I have another 2 sisters and a brother.
Mm-hmm. So because of a family history, you thought it was important for you and maybe your other siblings to have a check?
No, it was just I was having a shower, and I just ran my hand over my breast, and I felt the lumps.
Mm-hmm.
So that's how I said, okay, I might as well go and have that checked out.
Yeah. Would you like to tell me about your treatment process?
Okay. I had the surgery done in March of 2016.
Mm-hmm.
After the surgery, I just started going for the clinics, and in June was when I started with my chemo. So I had 4 cycles of chemo.
Mm-hmm. How are you feeling now?
Good.
And it's such a strong and such a great story, and one needs to take that courage to come and talk about it. It's a great, I must salute you, Irene, for coming on the show and for being on national television and Gold FM radio station to encourage other women to take heed of this, because life is so precious. Inoki, you are with the Fiji Cancer Society. So what kind of programs or services do you have in place to educate women and to create awareness?
We work very closely with people like Irene, who are part of our network, who's been very brave and strong to come on the program and share her story. We have a survivors network, and we work closely with them, and we use them in all our awareness programs when we're doing road shows. We work very closely with the Ministry of Health. You would have heard from Dr. Ane that we don't do any clinical services. Our work centers around more awareness, advocacy, and critically we like to, one of the key things that we focus on is really prevention, and there and abouts encouraging people to come in for screening.
So, okay, do you have outreach programs for women in rural areas as well, or the focus is mostly through Central Division?
So we work with the Ministry of Health. They're our key partner. We work very closely with them in the key centers. So Suva through the CWM, Lotoka or the west through the Lotoka Hospital, and then in the north through Lambasa Hospital. And then within those areas, we work closely with the Ministry of Health's community nurses. So when they go out, they do community awareness programs where we can link them with our survivors, and we have support groups as well who go with our community nurses. We provide that kind of support to the community nurses to raise awareness.
The Fiji Cancer Society normally has this morning tea with the help of your supporters and business houses, where you collect money, which happens every year, right? So what do you do with this money? How do you use it?
It's the Bushels Fiji's biggest morning tea event. We've partnered with Motibuys, who are the distributors of Bushels tea, to do this. This is our 11th year. We've raised significant funding. In fact, the major part of our funding comes through our fundraising programs, part of which is through our tea fundraising events.
And I think various offices also come and support your morning tea, right?
So people sign up or they register to host the morning tea, and then they get their staff to contribute. They give a corporate donation as well. The funds, to answer your question, go towards, so we work in providing clinical consumables. So we get things, we purchase colostomy bags. There are other cancer consumables that we purchase, and then we help distribute through the community nursing program.
Mhm.
We also provide, in some cases, we will procure drugs for chemotherapy. So sometimes we provide that kind of assistance to the major hospitals. If they need urgent drugs and they don't have them stockpiled, we would then use our network to buy
So
these
do you work
drugs.
with, do cancer patients come to you directly, or do they go through a Ministry of Health to
There are
get services?
different entry points for patients or people that maybe detect that they probably have something. So they will come through our doors. We call them our walk-ins.
Mhm.
They come through the Ministry of Health's oncology team.
Mm.
Sometimes they will call and come through our survivors network. So there are different ways people front up. And we, at the moment, we are working on an MOU with the Ministry of Health to provide to support their cancer registry. So the Ministry of Health have a cancer registry, and this will just allow us to make sure that we have our works connected, really.
Okay.
That the numbers that are coming through our doors and the numbers that are coming through the Ministry of Health, they correlate. And in some cases, if they come to us and they haven't reached the Ministry of Health, sometimes they front up and they're not quite sure. They're nervous, maybe the stigma around what they've seen maybe their mom or dad go through. In some cases, there's some disturbing stories where people have been left in hospitals unattended, or in the communities, nobody wants to go near them if they have, if perhaps the lady's suffering from cervical cancer. So people, because of that stigma, they're very, very scared to sort of come and check. We connect them to our survivors network. They talk to them. They
Which I
encourage
was
them to
going
come
to
in.
ask Irene, how many are there in the Survivors Network? How many women are working?
We have a few ladies, but like with the network, we have, they don't come all the time. So we have different ladies coming in every time in the when we have the survivors meet. And we have our survivors meet every fortnightly.
What message would you like to provide women in the community?
I would advise the ladies always to check on their breasts, because it's best when you first detect it and then you go and look for treatment and see about it, then leaving it until later and letting it go bigger. So it's best if when it's at the beginning stage, you have a bigger chance of survival then.
What kind of support would they need, do women need from their family? Because that is so important. Normally a woman would say, yeah, fine, maybe I should go. Or she needs that little push, right? So what would you like to tell the other members of the family?
Family support is very important. If the woman is married, I would advise the husbands, the children, to encourage her to go and have her checked out, because leaving it later, you're taking a risk.
And you could lose a precious life.
Yep.
Someone very close to you, your
And
mom.
we've had a disturbing, and we had one survivor who's no longer with us this year, Salome, who we used quite significantly last year in our campaign around this time. She had her story was that her husband left her, and she brought up her children on her own at the same time, going through treatment and battling this illness. So family support is critical. We have a support through the work we're doing in the community. We've these support groups have kind of grown out of it. And it's parents, we work close with WOWS, so WOWS have a children's support group. In our major centers, we encourage the survivors to link up to the support groups. And these are people who have had loved ones, they've lost loved ones to cancer, but they're still working. And they
So
see
there's a
what
support
it's been
who
like.
give
So
them
they-
hope, and then Fiji Cancer Society is there to help these women whose family, for some reason, have abandoned, which is quite sad. So we need family support. We need you to support your mom, your wife, your sister, aunt, or anyone who's the family who's been diagnosed with this cancer. And thank you very much, Irene, for coming on this show,
Thank you.
for being a great advocate to tell women. And I know a lot of women know about this support group now. Thank you, Inoke. Fiji Cancer
Thank you for
Society is
having
doing a great job, and through programs like this, we'd like to create more awareness in years to come. Thank you for coming on the show once again.
Thank you.
After this break, we are going to meet with a doctor from WOW's Kate. We'll be talking about cancer in children. Welcome back on Speak Your Mind, and I have with me Dr. Miriama Tukana. And Doctor, you work with children with cancer, and you're based at the CW Hospital?
Yes.
So tell me, Doctor, more about what is the most common form of cancer found in children in Fiji? Earlier we talked about women.
Yeah, in children all over the world, the most common cancer is leukemia. That's blood cancer. Second up is brain tumors in children, and the third up is kidney tumors, which is called Wilms tumor.
So what is most common in Fiji amongst
In Fiji,
children?
that is the same. We have blood cancer that is most common, second by brain tumor.
So what has the research and the report in the recent years been reflecting the age group and the reason why this occurs?
Yeah. So the age group, they usually present around the ages of 3 to 5 year olds, are very common age group. And as they get older, the other cancers are more prevalent. Leukemia in itself in Fiji is treatable. So we're very happy. In the past 5 years, the cancer survival amongst children was very low. But recently, it has more than doubled, and we're happy that we're able to treat more and more children with leukemia successfully in Fiji.
So what should a parent be looking at? What kind of symptoms should they be on a lookout for?
For children with cancer, the signs and symptoms are they're non-specific. It could just present like a common flu, like body aches, having headache, fever, just being unwell. So the advice is just to, if you have those symptoms, if your child has those symptoms, you need to go and see a doctor, get it checked. Make sure it's not a worrying thing, and it's just a common cold or flu.
So you've seen the trend in Fiji. Normally we ignore things like if a child is suffering from common cold, we say, oh, you'll get well, but it's not. It shouldn't be the case, right?
Yeah, in Fiji, that's the thing that we struggle with, the health-seeking behavior.
Yeah.
It's not there. Recently, it has sort of improved, but it's still not there for us to, the stigma is still there amongst our population. Thinking, they know it might not be a common cold or flu, and so they're like, maybe we shouldn't just go to the hospital. They might tell us it's something serious. That feeling of, I always encourage them to come early, get it picked up early so it can be treated early.
Is there some kind of awareness program to help parents and children?
WOWS has launched a childhood cancer awareness month, which was the month of August.
Yes.
And we've had, they've organized various activities to create awareness and raise funds for childhood cancers. We've had the morning walk. We've had a fundraising ball. We've had other launches and morning teas that we've also done to create awareness. We've launched banners and bookmarks to give us the signs and symptoms of cancer that we should.
So how many children were treated for cancer in August?
In August, currently we are looking after 30 children in my unit, oncology unit in CWM. We're actively looking after 30 children. 20 of them have completed their treatment of cancer, and we're just watching that they don't relapse. And 10 are on current treatment right now.
So how long does the treatment take? How long does it take them to get back on their feet and recover completely?
Yeah, so for leukemia, the most common cancer, the treatment is very long. It's 3 years. We have to continue chemotherapy for 3 years. It's a long journey for a parent, for the family, and even for the child.
Is it a very costly affair as well?
It is a costly affair the treatment is free. The Fiji government offers treatment for free. In terms of coming to the hospital frequently, staying in hospital for prolonged periods of time, those are costly things that we
Yes.
and WOWS has been very instrumental in helping us deal with those aspects of things.
So as we speak, how many children in Fiji suffer from cancer generally?
Generally, we have a small percentage, maybe 2% of the children. I'm not sure of the statistics. We don't have any published
Okay.
statistics.
So
yet in Fiji.
how was it discovered? Because is it because children had common flu or fever, and when they came to the hospital, it was discovered they had cancer, or did parents found some symptom, they were aware of it?
Yeah, usually, like I said, it's very non-specific. They come to the hospital, they get antibiotics, but it's just not going away. So they continue to come, and so when the first line of treatment doesn't work, then you have to look for another cause, and that's when we pick up that they have on their blood results that they have cancer.
So apart from working with WOW's kids in Fiji, they do a lot of awareness program, and
Yes,
I know that. So what other program does the CWM hospital have to help children with cancer, or some kind of awareness programs?
We work very much in conjunction with WOWS. We support everything that WOWS do. Their awareness campaigns. We've currently just launched our child cancer policy. That is just the governing document for us on how we should function as a unit, child cancer unit. Yeah.
So what is one important aspect of that policy?
Just to make sure that every child with cancer gets adequate treatment.
How about hospitals around Fiji, private practitioners? If it does come to their attention, do they refer them to the CWM hospital?
Yes.
They do.
Yeah, we have a good referral system that they can just pick up the phone and call us and refer a case where they suspect who have signs and symptoms of cancer.
And-
We've had a few referrals from the private GPs. I mean, it's out there, and they are very much aware.
What kind of message would you like to give to parents?
Yeah,
What message?
I'd encourage them to have that health-seeking behavior.
Yes.
If they think their child is just not getting better from the first line treatment, they should keep asking what else is wrong, and just come to the hospital and get it checked early, so we can pick it up early before it goes on to the later stages where.
Yeah, that seldom, or maybe often, when a child comes to mom complaining about some kind of ailment or pain, we sometimes ignore them, or we just tell them it's minor, or you're complaining, or you're pretending. I think this kind of behavior has to be sort of thrown out of the window. We
Yes.
need to take more interest in our children. Thank you very much, Doctor. You're doing a great job. And we'd like to thank the team at CWM Hospital, and of course the WOW's Kid, who are looking after the welfare of our children. I encourage parents to please visit your nearest doctor. Go to the to WOW's Kid or to CWM Hospital Children's Ward if you find there is something that, to take your child for a general checkup, etc. Thank you very much, Doctor. We'll take another break, and after that we are going to meet another nurse, Rizina Lailai, and we're going to talk about rheumatoid fever. So if you have any questions related to this, please do call during this Talkback show.
The earlier version of rheumatic heart disease is rheumatic fever. And rheumatic fever starts with sore throat, not just one episode, but it's a repeated episodes, like recurrent sore throats that keep on coming to a child who is between 5 to 15. And a sore throat can later lead to rheumatic fever, which can later lead to rheumatic heart disease, and rheumatic heart disease kills.
So is it if an adult has sore throat, could that be a sign of a rheumatic fever? Or is it only prevalent in children?
A study conducted in 2005, the second phase that was conducted in 2014, revealed that rheumatic fever is prevalent amongst children between 5 to 15 years of age.
Okay.
And a person who is above the age of 35, it's difficult for him or her to get rheumatic fever.
So rheumatic fever starts with sore throat. That's the first symptom to notice.
Yes, with sore throat that's caused by a specific bacteria called group A streptococci, or gas bacteria.
So if someone does have sore throat and has it quite frequently, which doctor should I consult then?
The child's parents can take the child to any Ministry of Health facility and can see any doctor. For people in the Central Division, we have Children's Hospital, and the children can be seen by any doctor at CHOP, or Children's Hospital outpatient.
So how can rheumatic fever affect my heart or anyone's or child's heart? You mentioned that from rheumatic fever you get rheumatic heart disease.
Yes.
How long does it take from getting a sore throat to a rheumatic fever into a heart disease?
Okay, let's talk about sore throat or strep throat. If it's recurrent, this is the most common cause of a child going into rheumatic fever. So if the sore throat comes and goes, well, the child will definitely have rheumatic fever. And something important for parents and carers to know at this point is that sore throat, this sore throat, we should be understanding this sore throat very well. There are certain other types of sore throat caused by virus, but this sore throat that I'm talking about, which is caused by group A streptococcus, the signs and symptoms of this are fever and painful swallowing. Even saliva upon swallowing is quite painful. And food going in, penetrating against the swollen tissues is quite painful. So all in all, this sore throat is really, really painful, which does not allow the child to swallow even the saliva comfortably.
I know there has been a lot of awareness on this, on
Just found out that two things: hygiene and sanitation. So children should be taught hygiene. Parents and carers listening in today, it is very, very important that children are taught to cover their mouth and their nose while they cough or sneeze, so that they do not pass the bacteria, if they may be having it there and then. And the other side is like the hygiene in terms of hand washing. Children must be taught to wash hands before meals, after visiting the toilet, or after coming in contact with any dirty stuff, because they could be carrying germs, and this specific bacteria or germ called group A strep bacteria could be just there on the surface of their hands. And also keeping the fingernails short and clean, and brushing their teeth, and keeping the compound clean. Rubbish should be kept inside a closed bin, and decomposed items or stuffs must be kept closed and disposed of properly, because these things can attract germs.
Where do you get your cases from? People who come complaining about rheumatic fever or rheumatic heart disease. Is it mostly from Central Division or interior rural areas? Where do the cases come from?
Thank you, Shami. The cases come from everywhere in Fiji. Like I said, it's one child in every classroom. But because of the population-wise, Central Division has the highest population in Fiji, we have a lot of cases from around the Central Division.
And these are children from which age bracket?
Like I said, the signs and symptoms of rheumatic fever appear when to any child who is between 5 to 15 years of age.
So what is the treatment for children who have got rheumatoid heart disease, rheumatic heart disease?
Thank you, Shami. For done, they will also confirm evidence of preceding streptococcal infection through throat swab, and X-ray can be done as well. The other clinical assessments will be conducted by the doctor. All these will confirm that a child has or does not have a rheumatic fever.
So if a child does have a rheumatic fever or rheumatic
complaining of sore joints or sore swollen joints, please take your child to the nearest health facility and ask the doctor if this could be sign of rheumatic fever.
But this can be controlled. If someone does have rheumatic heart, there are survivors, right? What are the chances of survival?
The chances of survival are high if the case is reported early. So conducting this awareness, we are thankful that we are given an opportunity to preach this message. Do not wait until the
Has been the response from public at large and from parents and from schools and other areas. We'd like to hear some experience and some success stories. So we'll be back right after this break. This is Speak Your Mind Talkback Show. You can call and ask questions related to rheumatic heart disease, and Rosina Lailai is here to talk more about rheumatic heart disease. And Rosina, you said that you are the coordinator for Central and Eastern Division on creating awareness on rheumatic heart disease. Tell me more about this program. What happens?
Thank you, Shami. The Fiji Rheumatic Heart Disease Program is under Ministry of Health, based at the Wellness Center at Namosi House, and the program has interventions on the ground. And one intervention is a patient support group, whereby one of the officers, we go down to the patients who are known cases of rheumatic fever or rheumatic heart disease. We collect these patients at a specific venue, and we conduct a session, educational session on rheumatic fever or rheumatic heart disease, making them understand more about the disease that they suffer from and the treatment and the possibility of recovering if they adhere to their treatment.
So do you have survivors who network with you and as a support group who go and advocate on this to create awareness?
Yes, Shami, we have our champions who help the program in creating awareness to their peers. And one such person is Miss Mbuli Waningolo, an 18-year-old young lady who contested in the hibiscus pageant.
Yes,
and
she was amazing, wasn't she?
She was
Yes.
amazing, Shami.
Yes, I really admired her during that.
Yes.
She was a very bold personality who advocated on rheumatic heart disease and a survivor.
Yes, and she was the youngest contestant, 18-year-old, but she had a lot of courage to stand up and use the hibiscus as a platform to educate the general public on rheumatic fever and rheumatic heart disease.
Tell me, Rosina, if a person is or a child is able to overcome, is treated, which what this awareness program is all about, getting early treatment, like you said, what happens after that, after a person survives the rheumatic heart disease? Is there other kind of symptoms and difficulties they go through in their life?
Okay, before I answer that, I would like the public to know the signs and symptoms.
Yes.
If the children has rheumatic fever, the most common sign is sore joint, which may or may not accompany swelling. And the joints affected are commonly the wrist, the elbow, the ankle, and the knee.
This could be, these signs could be from a toddler to a child aged about 10 or 12?
As long as the child is between the age of 5 to 15.
To 15, okay.
Yes, this is the group that is mostly at risk of getting a rheumatic fever, and that again from previous sore throats.
So do you have statistics where it is revealed how old was the youngest patient?
Yes, Shami, we
is-
have a database that is called the Rheumatic Fever Information System Database, and we have registered about over 4,000 cases
Cases in
of
Fiji.
rheumatic fever or rheumatic heart disease in Fiji. That is quite high. I would say that is quite high for a small population like ours, and it is alarming. And then again, linking it back to what I said previously, the prevalence rate is quite high for Fiji. There is one child in every classroom is
Yes.
found out to have rheumatic fever.
And personal
rheumatic heart
hygiene
disease.
is important, like
Personal
you mentioned
hygiene
earlier.
and sanitation, these are the two major contributing factors to someone getting rheumatic
What are the
fever.
other symptoms apart from joint pain in joints?
Sore joint is the most common one, and then if the child has rheumatic fever, fever too can be there, fever, and also a skin rashes appearing on the chest, on the tummy, on the back, and then can be also swelling just underneath the skin, appearing beside the joints. It's painless. It's almost like a marble underneath the skin, appearing beside the joints. And one of the signs is also chest pain. It's not a heart attack. It's not a sign of heart attack, which affects adults, but this affects children between 5 to 15. So when a child between the age of 5 to 15 has chest pain, parents think rheumatic fever. Take the child to the doctor. And also a strange sign
Yes.
which is called chorea, chorea, which involves the movement, uncontrolled movement of the face and the hands and the legs.
When you say uncontrolled movement of the face, is it twitching of the face or just any?
It's twitching. It's like just odd movement, something like that.
Yeah.
And this starts with it's like milking syndrome. If a child holds a pen,
Right.
it's like the movement goes like that. Or it can start with just a mild twitch of the eye.
Okay.
And if a child has changes in handwriting recently, messy handwriting, parents and teachers think rheumatic fever. That could be the earlier stage of chorea, which is the definite sign of rheumatic
Rosina,
fever.
you mentioned earlier that every child in a classroom suffers from that. So do you have one child in a classroom.
classroom.
So do you have some kind of awareness programs in school for teachers to notice that? Do teachers notice this and they report to the ministry or to health centers? And is there a kind of program? Do you get such feedbacks from schools?
Shami, the program is going to school, primary schools, high schools. We have spoken and created awareness on rheumatic fever and rheumatic heart disease in schools like Dudley High School, which has about 1,000 roll, and other schools around Suva. There are the other divisional coordinators in the north and the west. They have also gone into like some schools, and it's ongoing program. And also the teachers are also during CAPS meeting we are invited, where teachers are there with the students and with the parents. This is a new thing that the few schools in Suva have done. They invite us to come and speak on rheumatic fever and rheumatic heart disease during CAPS meeting.
Do you involve parents in this as well?
Yes, we involve parents during a patient support group and also CAPS meeting.
Do parents come forward?
Parents come forward and they are very keen to know more. And after we conduct talks on rheumatic fever and rheumatic heart disease, they come and see us personally if they know that one of the children at home has the signs.
Rosina, you talked about lifestyle, hygiene particularly. Is there any diet related to these? Do we need to take control of our diet to avoid rheumatic fever or heart disease?
There's nothing significant on diet, Shami. children can eat anything, but then again, our advice on healthy dietary intake for children is paramount. Parents must make sure that the food on the plate should be there should be lots of fruits and vegetables, about 50%.
Healthy diet.
Yeah,
yes.
healthy diet. What is on the plate should be fruits and vegetables. We do not preach like you can eat almost anything, but then again, parents must be mindful. A healthy child that's growing should be taking healthy meals. But then again, all these rheumatic fever, which starts with repeated sore throats
Yes,
and
like you
skin
mentioned
sores.
earlier, yes.
This is something to do purely with hygiene and
Okay.
sanitation.
So, what does rheumatic fever do to a child?
Thank you, Shami. Rheumatic fever, every time the child has rheumatic fever, manifested by the signs that we have discussed, fever, skin rash, chest pain, funny jerky, uncontrolled movements, and painful joints, every time that happens, it is affecting the heart valves. It's causing direct damage to the heart valves, and the heart valves are doors to the doors of the hearts, which control the blood to flow in one direction.
Okay. Rosina, thank you very much for giving such good information and very valuable information regarding rheumatic fever and rheumatic heart disease. I'm sure you have learned so much. I have learned so much about cancer in women, cancer in children, and to conclude with rheumatic heart disease and rheumatic fever. Please do take heed, read more about this, and take help if necessary. Thank you very much for coming on the show, Rosina. I'll see you again next week on Tuesday at 12 p.m. on Speak Your Mind.